The pitting edema occurs when excess fluid builds up in the body, causing swelling. When pressure is applied to the swollen area, a pit or indentation will remain. Although it can affect any part of the body, pitting edema usually occurs in leg, feet, and ankles. Pitting edema is commonly caused by poor circulation or the retention of the excess fluids. Some common risk factors that may lead to these problems, including the sitting or standing in the one position for too long and low protein levels, obesity, and pregnancies. Pitting edema is generally a problem caused by a variety of issues such as heart valve problems, low protein levels, deep vein thrombosis, severe lung disease, congestive heart failure, venous insufficiency, liver disease, renal failure, kidney failure, or obesity, pregnancy, administration of intravenous fluid, or medications. So, how can you prevent it? Staying active can help. Avoid sitting for extended period of time. If you work at a desk, set a timer to remind yourself to stand up and move around for a few minutes every hour. Exercise increases blood flow and which may help reduce swelling. Talk to your doctor before starting any new exercise routine.
For accessing edema, take thumb and press on top of ankle, foot, or shin for about 5 seconds. Then you will observe, for 0 plus, you will observe no pitting edema, and for 1 plus, you will observe mild pitting edema, that is 2 millimeter depression that disappear rapidly. For 2 plus, you will observe moderate pitting edema, that is 4 millimeter depression that disappear in about 10 to 15 seconds. For 3 plus, that is moderately severe pitting edema, that will be 6 millimeter depression that may last more than 1 minute. And lastly, there will be severe pitting edema, that is 4 plus, and it will be 8 millimeter depression that can last for more than 2 minutes. So that's how you will access edema and estimate the edema.
Hello ma'am, how are you doing today? I'll be examining your legs for any edema signs today. So if you feel any discomfort or you feel any pain, you let me know. Should I start? Yeah. Yeah. Firstly, check the patient's leg for any sign of swallowing or any sign of change in the color or paleness, or there is any change in color like blue color of the skin. There is no swelling. I think both legs are symmetrical. Let's check for the edema sign. Press for Take your thumb and press for in the regions for about 5 seconds, and then release it and see for any sign of edema. So there is no. Now let's check above the ankle. So here I'm so there is also no signs of edema. So let me up. So there are also no signs of edema. So the patient has no signs of edema. So I'm recording this. The patient has no signs of edema. So report this to your nurse after this, and inform the nurse about the situation that the patient has no signs of edema. Further, I will be placing a pillow under your legs to feel comfortable. Okay, so that's all. Thank you for